And we're live tweeting this morning at #L2020. Now I'd like to hand it over to our host, Lou Piero. Morning, Lou.
Good morning, everyone. Welcome to the 25th Annual Elder Law Forum. I'm going to try to get control of my slides. There we are. As always, I'd like to thank our sponsors who very generously agreed to take this flyer with us and do a virtual Elder Law Forum: Quantic Bank, NYSARC, Advisors Insurance Brokers, and our new sponsor, Beacon Communities. Thanks to each of you for helping to make today's presentation possible. And again, we do apologize for the delays, and we're going to get right on to our panel. If you missed last week's session on May 21st, we had housing challenges and home care challenges. So housing has been taking different initiatives. You can see those two presentations on our website. So if you go to purolaw.com, you can see the wonderful speakers we had in both of those panels to talk about senior housing, nursing homes, all the way through to new innovative independent housing and the challenges currently being faced in the home care community. We'll get to today's presentation in a moment. Next week, on June 4th, financial issues in aging. We have a great panel. We'll talk about that at the break. And elder and financial abuse, prevention and cures. Again, an outstanding panel. We hope you can join us next week. For today, I'd like to introduce to you someone who you know already if you're in the Capital Region. She's a longtime Capital Region news anchor and a host on WNYT, the NBC affiliate. She's a health reporter and host of Health Beat, digital health interview program. She has a weekly column called Live Smart at the Times-Union and holds a doctorate in professional studies in bioethics. And she's a friend and has been part of the fabric of this community for many years. I give you Benita Zahn.
And good morning, everybody. Yeah, and I have to apologize. Let me take it all on me. The computer gods conspired against me this morning, so that's why we're a little delayed. But we're here now. I'm really excited to be able to be with you. So let's waste no more time and let me introduce our fabulous guests to you today. Joining us are lawmakers from across the state, and they include Rachel May. She's the chair of the Senate Aging Committee, and she represents Syracuse, my old stomping ground, and Central New York, the 53rd District. Welcome, Rachel. Also with us today is Harry Bronson. He's the chair of the Assembly Aging Committee, that's the one, and the 138th District, and that includes Rochester. I didn't work there, but it's a lovely town, Harry. Also, John McDonald, who's so well known to all of us here in the Capital Region, also sits on the Assembly Insurance Committee. He represents the 108th Assembly District, and he's also a practicing pharmacist, and he interfaces with seniors on a daily basis, as that's much of his population, his consumer population. And from Long Island, my original hometown, we've got Assemblyman Steve Stern, an elder law attorney and member of the Aging Committee, and he represents parts of Suffolk County in District 10. We thank you all for being with us this morning. So, and you know, I'm glad they've laid out some groundwork and questions here because, you know, I would go to town, but I want to start with Senator May. At the start of the year, we all know the state was facing a huge budget, $6.2 billion budget deficit. Medicaid cuts were proposed for home care. Now the deficit is projected to be tens of billions larger. So how has the COVID-19 crisis affected public policy with regard to home care and aging in place?
Thank you, Benita. Good morning, and good morning to my colleagues. I want to thank Piero, Connor, and Strauss for hosting this, and everybody who's on this webinar. Yeah, so even before the pandemic hit, we were struggling to figure out how to fund our home care and long-term care in general. The cuts that we were facing before the pandemic threw our entire budget off were going to be really difficult to deal with. And I think the crisis now has exposed a lot of weaknesses in our whole system of how we care for elders. We know that home care is more economical than nursing homes for elder care, and many seniors prefer that. But we've had waiting lists. We were dealing with that problem, getting people off the waiting list for home care services. But I think now, between the MRT process that was in train before the deeper cuts were made, we were going to be making it harder for people to get some of those services, and increasing the number of activities of daily living that were required for people to qualify, and that sort of thing. I think the thing that I've been focused most on ever since I came into office in 2019 has been the issue of the elder care workforce. And that's one that I think we have to focus on even more now that these people who are doing this really important work, where we recognize them as essential workers, but we don't reward them, we don't pay them, we don't, as if they were essential workers, we don't value them in our society the way we should. And so the pandemic is going to force us, I think, in a good way, to really reckon with who's doing the essential work in our communities and what they deserve in return. So honestly, I think the number one thing is we're going to have to identify new revenue streams in order to pay for the services that our elders need, and to recognize that this is us. We are all potentially people who are going to require home care services, and we have to wrap our minds around that, and make sure that we are fighting to make our budgets reflect how important this is for our entire society.
Senator May, I think we could probably do an hour or two on just this very topic. I think a lot of seniors and those who care for the folks in our senior community feel that home care is targeted, that perhaps their lobby is not rich enough to be heard enough. But I'm going to move on, and we're going to get back to some of this. Assemblyman Bronson, COVID-19 has reminded us that we have to invest in infrastructure, and Senator May touched on that. What are lawmakers doing to protect seniors, and what personal protection needs are we looking at?
Yeah, well, first, let me thank everyone for participating in this, my colleagues, you, Benita, and certainly the host of the program. And I'd also like to say, for all the folks who are listening and watching, we have to keep in mind that in this pandemic, we understand that people are facing financial crisis, health crisis, and personal crises as a result of the pandemic. And we will get through this if we work together and we support each other. And I think when we talk about the healthcare arena or industry, if you will, it heightens the need for collaboration among the direct healthcare providers, the social service providers, the other folks, the providers of financing and things of that nature, directly to how do we protect those workers, and how do we protect the consumers of our services is important. We passed a number of measures last night into the wee hours of this morning. We finished around 2:30 this morning. So I'm going on 3 hours of sleep, as my colleagues are. But that being said, one of the measures we passed last evening was a requirement for residential healthcare facilities to put together a plan of action in connection with pandemics. And they have to submit that on an annual basis to the Department of Health. That plan of action necessarily will include personal protection equipment, both for the people providing the medical care as well as for the patients or residents if they're at home. We have another bill, which I would have liked to have seen last. That bill number, by the way, for people to look it up, is A10394. And then there's another bill which did not make the agenda last night, but we need to take it up. And that is Chair of the Assembly's Health Committee, Assemblymember Dick Godfrey, has a bill. It's A10451. And that would require Medicaid plans to make payments for personal protection equipment for home and community-based long-term care services. Initially, it would be funded through the managed long-term care plan. That plan, right now, we're running a surplus, which boggles my mind that that exists, but we're running a surplus. And so initially, the funding source would be that surplus, and then we'd have to look for other areas. In addition to that, there have been a number of funding issues that we have received through the federal government. One is making sure that there is funding allocated to expand Older Americans Act Title III grants, and those are for support services, which include social service, nutrition, and caregiver support programs. That could include personal protection gear as well. $6 million of federal funds allocated to expand caregiver support services, which includes counseling, training, and respite care. And then another $1.2 million on the Ombudsman program for older adults. So there's a lot of things happening right now. But as we go through our discussion, one area I really want to talk about is how do we break down the silos in our delivery of medical care? And that's for the various direct medical care providers as well as the social service providers. How do we connect the care given in hospitals and in nursing homes with the care that's given community-based? And how can we emphasize, and Senator May mentioned this, if we spend more money and support the services to keep older New Yorkers home longer and delay long-term care, that is a cost saving and it's a quality of life issue. So, and we can only do that through collaboration of the various programs and providers. So we have a lot to talk about today, but that directly on PPE, that's what we have. I did fail to mention, we also passed last night Bill A10326, which is whistleblower protection. So in the healthcare arena, some argued they already had protection under a current whistleblower law. As a labor lawyer, I'll leave the elder law to Steve, but as a labor lawyer, we really did need to do that bill last night. It expanded whistleblower protection. So if an employee complains and makes aware of violation of regulations and services to patients and residents, then they're going to be protected with their employment status.
Thank you, and I know that the nurses have already come out and applauded that. Assemblymember McDonald, much has been discussed about CDPAP and MLTC cuts, which is unfortunate, of course, as the program's intention is, of course, to improve quality of care and reduce potential cost exposure to the state through the continued use of long-term nursing home beds when not necessary. So one would agree these programs have the potential of a win-win, but with the state, does it not see it now? I mean, bottom line, what went wrong and how can it be fixed?
Yeah, thank you, Benita, and Lou, thank you, and it's great to be with my colleagues. You know, the post-mortem is still in play. We're trying to figure out what went wrong. I guess one of the things that went wrong is what went right, is that there was a huge amount of participation in the program. What started off as maybe a line item of $300 to $400 million a year about 5 or 6 years ago was up to $1.9 to $2 billion a year. And that's a function of increased participation. It's a function of the fact that there were a lot of individuals getting services. I think, as I've learned a lot through this process, I think my colleagues will agree, maybe except for Steve, who's been in this practice a long time. Not too many of our colleagues knew what a fiscal intermediary was 3 or 4 years ago. We now know. And many of those organizations grew. People make money off bringing people into the program. And at the same token, the plan originally was designed for those individuals who were just short of going into a nursing home, or people that, if not attended to quickly, would be a nursing home candidate. We know people prefer, as Senator May said, to live in the community, to stay in their home. As a former mayor, I've always appreciated the fact that our elders stayed in the community. They are what are the stabilizing forces of our neighborhood. And we also know that if they go in a nursing home, the costs quadruple, if not much longer. So I think, we've made some difficult decisions with this program. I think most of the issue is on kind of getting the fiscal intermediaries under control a little bit, maybe winnowing out the field a little bit, trying not to really cut services to participants, but inevitably it's going to happen. I think what I learned too, and this is my last comment on this, is that, there's eligibility criteria. And I think the state kind of took its eye off the ball a little bit, as they would do with a new program, trying to get an idea what's going on. And I think our eligibility criteria is probably a little bit more wider than it should have been. There was a lot of different, more than anecdotal stories of people who were pretty much walking fine throughout the city of New York, no problems, but they also had somebody tending to their needs all day long. So I think we need to, we're putting some margins on the program right now, but the goal is to kind of get it under better control, because we know it's really the best type of program for people.
Yeah, thank you. Assemblyman Stern, given the dramatic increase in the older population, particularly in New York State, do you think simply increasing government spending is the best option to provide additional long-term care services, or do we need to explore more private solutions?
Yes, well, first of all, good morning, and it's good to see my colleagues this morning, thank you for having me. So, particularly now, maybe even more than ever during the course of my experience in working with our older neighbors and their families throughout the state of New York, now really is the time to look beyond just increase in funding, just increase in government spending, but other alternatives. And I would agree with my friend Assemblymember McDonald. Part of the challenge that we're facing right now is the success over the past couple of years that home-based services and those programs have had. 2016 to 2018, the over 75 population in New York increased by 4%. But the CDPAP program increased by 31% during that same time. The numbers just don't keep up with themselves, and that kind of increase, which we want more of our seniors remaining in the community. That's where they want to be. That's where they need to be with that kind of assistance. But just looking at increased government spending just cannot possibly be a sustainable solution. And so I don't sell it, which means I can speak to it objectively, but long-term care insurance will continue, and I think going forward into the future need to be that much more of an important element in meeting the high cost of long-term care across the entire spectrum, whether that's at home, in an assisted living facility, continuing care, retirement community, or even ultimately a high-level skilled nursing facility. I actually have a bill that I introduced, which is Assembly Bill number 8456, which speaks to long-term care insurance specifically. And I'm sure we'll get to some of this later on in our discussion, but long-term care insurance, for a myriad of reasons, might not be the best option for those that are of advanced age or been diagnosed with health problems. And we've seen tremendous challenges over the past couple of years, in particular across the industry. But what more and more consumers are going to is a hybrid type of a policy, life insurance policy that has a long-term care rider attached to it. Many feel that as a consumer that is a more favorable product. And if that's going to be at least part of the future of a private solution, then I think it's important for us at the state level to help facilitate that and make it more attractive to the consumer. And so A8456 is legislation that would provide for a tax incentive for the long-term care portion of that policy to make it a more attractive purchase to the consumer. Again, I think looking at a private option to be a part of this conversation, to be a part of the solution for seniors and retirees going forward, that long-term care insurance needs to be a part of that mix. And this effort right now, we're working with members of Lycone for their expertise, and also working with Congressman Tom Suozzi, representative from New York, down from Long Island. He serves on the Ways and Means Committee, and he has a keen interest in this issue as well. And so we're trying to coordinate our efforts at both the state level and the federal level to provide this type of tax incentive to consumers going forward, to make sure that that can be at least part of the mix.
Assemblyman Stern, would that do enough to offset what has been a continual increase in those premiums, and that's become very off-putting and for consumers, and many haven't been able to purchase and have in fact dropped out because of it?
Yeah, and on all the years that I've been having this conversation with seniors and those approaching retirement age, long-term care insurance, number one, you have to be young enough and healthy enough to get it. And of course, you have to be able to afford it. And for too many New Yorkers, that it just hasn't been a viable option. And so this type of a hybrid policy, a life insurance policy with a long-term care rider attached to it, has been a more attractive product for people to consider as part of their financial planning. You know, it used to be that a straight long-term care insurance policy was literally use it or lose it. So you'd pay significant premiums during the course of your lifetime. If you no longer keep up with the premiums, you lost what was a policy. If you never used it, you lost on the back end as well. Here, at least if there is a purchase and you don't use the long-term care element, there is a life insurance component that ultimately you might not benefit from, but certainly your beneficiaries would. And so it's become a much more attractive policy. We need to make sure that if traditional long-term care insurance is not going to be a viable option, then in the private marketplace, something else is. And that combination of life insurance with a long-term care rider seems to, so far anyway, be a more attractive private marketplace product to consider.
Thank you. We all follow the news, and nursing homes have been devastated by the coronavirus, tragic consequences. What policies are contemplated to protect New Yorkers living with disabilities and chronic conditions in these facilities? I heard from somebody who's living there about a month and a half ago, and she literally was deathly afraid about this.
Yeah. I'll jump in on that first, Benita, and Harry knows this. You know, at some point, the legislature has been requested to have hearings on the whole nursing home crisis and part of the whole COVID-19. And it is tragic what has happened. I think, as Senator May has said earlier, this has exposed a lot of our weaknesses. I think a lot of our long-term care facilities had some infrastructure issues to begin with. Many will say is because of the state's continued and the federal government's continued decreasing reimbursement, which has not allowed them to reinvest. And I think, you know, as much as the governor's out talking appropriately about we need to get back into more public works projects, I think we have to bring the physical structures of nursing homes into that discussion. I think we also have, what's the old expression? When life gives you lemons, make lemonade, right? In the home care arena, sadly, we are going to have a lot of people who are not going to be able to go back to their jobs. I look particularly in the food service industry. There's going to be a lot of people on the sidelines looking to say, what is my next step in life? And going back to what we've all agreed with is that we need to find ways to incentivize people and to support individuals to go into the home care field. I think there's a lot of people that have been in the food service industry that just aren't going to have that job anymore. There's going to be capacity changes. And I think we need to find ways to incentivize them, because we do know at the end of the day, being home is what's preferred.
And along with incentivizing them, John, don't you all have to find some way to help to train them to be the best care provider? And that becomes another part to all this.
Absolutely. And you speak about the disability community. one of the projects I'm working on with NYSED is to try to find a way to allow those individuals in the disability community who always have had unacceptably high unemployment to be the producers of the PPE. In other words, incentivize them to have more jobs, to create PPE, to give to those who work in the home care field. It's kind of creating our own little economic ecosystem. But the reality is we are in a huge crisis. You know, this is probably my third rodeo between 2001, 2008, and now public life. We got to be bold. We have to start taking some chances. And, you know, it also speaks to telemedicine, which I know you're going to touch on too. We've got to start aggressively embracing technology, but also push the margins a little bit on things that we've been hesitant to do in the past.
So if I may add to what John just
Please.
said, first of all, yes, we are trying to get a public hearing on the nursing home situation, see what went wrong and how we can correct it. The bill I mentioned earlier that we passed last night, the sponsor mentioned several times, this isn't really finger pointing, it's how do we go forward? And so let's have plans of action as we go forward. This COVID-19 revealed, I think, some shortcomings in connection with the nursing home industry. Number one, DOH is not fulfilling its obligation as inspecting and as a regulatory agency in connection with the nursing homes. And so they have to step it up. Number two, there's clearly, and some nursing homes are very good, some are not. You know, the staffing requirements aren't being met. The current federal staffing requirements aren't being met. We need to look at those requirements, and we may do something more here in New York State. A pretty controversial bill that's been floating around for years. And I'm a person who believes in, you know, management and having some discretion there. But we also have to make sure that there's adequate staffing for the residents of these nursing homes. And then lastly, a measure that got in last year's budget that really created immunity to liability to nursing homes, and we have to relook at that. In connection with the workforce, here in the Rochester area, Common Ground, which is a research collaborative organization that really is the leader in creating collaborations and breaking down silos in our healthcare industry locally, and it's all data driven. I should mention, in my district, a 15-minute drive has a result of 8 years difference in life expectancy, a 15-minute drive. And that reveals the need when we're talking about healthcare. How do we not only address the actual delivery of healthcare, but how do we address the other components, the environment that people are living in, the nutrition that and other things that they have access to medical care, yes, but access to nutrition, access to transportation, understanding of the use of tobacco and those kind of things. And so what we've done here is we've created a mechanism where the health industry is working with the community-based industries that aren't necessarily in the health area. And how do they communicate to each other? How can they share information? Obviously, we have HIPAA laws, so they're working through those barriers. But importantly, to the home health aid and retaining and recruiting workers there, we don't have the final approval, but Common Ground has led a collaborative job training, job retention approach for those folks who are serving not only the elder population, but also people with disabilities and others with chronic illness who need these in-home or community-based services. So there's going to be a universal training mechanism that goes through Monroe Community College that every home health aide would need. And then there'll be more on-site job training that a number of nonprofit organizations as employers are participating. And so That's one component. The second component that came out of a program that I participate in, the Rochester Anti-Poverty Initiative, and I just mentioned the life expectancy. One of the things that came out of that was adult mentoring. How do we mentor adults to overcome barriers? In this case, barriers to accessing health care, barriers to accessing nutrition and transportation and childcare. We know that in the healthcare industry, home health aides are one of the lowest paid individuals, $10 to $13 an hour. Most of them are living in poverty. So the adult mentoring is there to help them overcome the barriers to successful employment. And then the last component of this is how can we put them on career ladders that move them, the entry level home health care, continue to create that pipeline through recruitment and training, but then also offer folks an opportunity for career ladders, whether it's certified nursing or something of that nature. So those are the kind of approaches we got through the first level of funding this pilot program through the $175 million that we put in the budget for workforce development. It goes through the various regional economic development councils. But then the COVID-19 hit. So we're kind of at a standstill right now. But this is a model that really we welcome other areas, and I actually would welcome a statewide program to do this. But that's how we're going to get people in this workforce and provide the services that our elder citizens need.
Yeah, let me.
Go ahead, Senator.
Yeah, thanks. So I'm glad Harry talked about that. We did have a proposal for a home care jobs workforce innovation fund in this past budget that didn't make it in, but we'll keep working on that. But it covers a number of the things Harry was talking about. I think I should mention that Senator Kennedy has a really good bill for establishing a program to incentivize unemployed individuals, people who've lost their jobs in the COVID crisis, to enter jobs in healthcare. So that, I think, is one direction we should be going in. I have a bill for student grants for essential workers, and one would hope that that would be one way that we could get some more people trained for this workforce as well. One thing we haven't talked about is the Ombudsman program, which is really important and has been kind of kneecapped in some ways by the crisis because the Ombudsman can't get into the nursing homes. They have to communicate remotely, and that's hard. And so it reveals both the need for better communication, better remote communication, more making sure we've got the infrastructure and the technical capability for people in nursing homes to communicate with their loved ones and with anybody who might be there to protect them. But also the Ombuds program has relied on volunteers, and it's hard work, and they may get reimbursed for their travel or something, but the hours that they put in is they should really be incentivized in a different way. So that's one thing I've been talking about a lot with the governor's office, trying to get the governor to promote the Ombuds program, because the morale is really low in that area right now. But to recognize that it's very important that people could be able to go into nursing homes and talk to the patients and their families and really identify where there are specific problems, because I think one thing we're seeing in this pandemic is how insular a lot of nursing homes are, and they don't want to let information out. Some of them don't even want to do testing. They think of themselves as closed systems, and that does not allow for oversight, and it doesn't allow for innovation, and it hurts the patients, I think, or the residents in the end. And also, there was something else I wanted to say, and just another thing we haven't talked about that is really, I think, something we need to put more resources into are the alternative living arrangements. So not just home care coming into somebody's home, but for example, the NORC system, the naturally occurring retirement communities. So when people, age all together in a community, then you can provide services to that whole community, to whether it's a high-rise building in New York City or housing development in a suburb, so that it's a much lower cost and much more productive way, I think, to provide services to people and to help them age in place.
It also normalizes the aging process and puts a face and doesn't let this community be as invisible as unfortunately they often are.
Right.
It brings us all together. I just want to remind everyone, if you've got a question, please type your question in the question field. We will get to it. I know that we had a question, a couple of them posed to us a little bit earlier from Dan Heim with Leading Age New York. And I just want to get to one of the questions to throw out to all of you. An Assembly bill would repeal the Emergency or Disaster Treatment Protection Act. That was included in the most recently adopted budget. And it confers immunity from liability, which Assemblymember Bronson referred to, confers immunity from liability for various healthcare facilities and caregivers like doctors, nurses, and aides. If it's passed, what will protect these facilities and caregivers from lawsuits when they acted in good faith, despite the shortages of PPE, the staffing challenges, and changing regulatory requirements beyond their control?
Well, as I understand the bill, what it does is it changes the standard of liability. Right now, you have to show gross negligence and intentional acts. And as I understand what the bill would do is it would reduce it. So there would still be, an opportunity. I mean, if people are following regulatory guidelines and following what they're required to follow, then they're going to overcome the standard that wants to replace the gross negligence and the willful intentional conduct with just a negligence standard. So if they're following the guideline, I used to do personal injury litigation all the time. So oftentimes the defense is, here are the regulations, here are the guidelines, this is what we did. So they're protected if they followed what the guidelines are.
And then I think it really comes down to what those guidelines are. So, for example, you could follow all of the regulations that are put out by State Department of Health, and have you complied with the standard? Perhaps that might still be a question of fact. But then there are other things that can and should be done as well. And although the specific pandemic and public health emergency that we're dealing with right now might have been at the top of everybody's list, that doesn't mean that there doesn't have to be required standard crisis planning for healthcare facilities along the way, particularly in good times when you're not knee deep in a crisis. And so, having had some experience down on Long Island with the aftermath of Hurricane Sandy is an example where it knocked out power to so many areas throughout Long Island for, in some places, up to 2 weeks. And some of the hardest hit areas had healthcare facilities like nursing homes that went dark and had to rely on weak generation systems for several days. And utility companies had no plan. The facilities had no plan. In the aftermath, working with administrators and some of our health professionals in the area, I wrote and passed the Protecting Our Most Vulnerable Act, which, among other things, required that these healthcare facilities come up with a plan. They come up with a plan, and they don't just come up with a plan on paper that they developed around their own table, but it requires that they have periodic meetings with law enforcement and first responders and utility companies. And again, you can't plan for every specific emergency, but you can certainly have a reasonable plan in place. And so Harry is right that yeah, I think you start with some of maybe the DOH and what they come up with to determine a floor standard. But then there's nothing to say that localities then can't go 1 or 2 steps better to make sure that if there is this going to be standard in the law, that those of us that are concerned about these issues and have responsibility for creating a legal framework, develop a legal framework that's meaningful, so that if there is an administration that's going to be held to that standard, that it is a meaningful standard.
Thank you. We've got a question from the audience. In really looking at the Medicaid system and the care needs of the elderly and seniors in our community, what's being done for those seniors who physically may not need a lot of assistance, but due to dementia or Alzheimer's require 24-hour care? What's being done to address this need of our seniors?
Well, I think what we have done with the help of Senator May in the area of aging, we have invested more in the type of services that are necessary. If someone has dementia and or Alzheimer's, the standard to get them that home care is slightly different without that. You know, they only have to have 2 life assistance requirements. I'm not sure I'm using the right phrase there, but we've increased the funding to address, as Senator May indicated, the waiting list. We've converted it so that to help the pressure on counties that run their offices of aging, we have authorized a pay for services mechanism. So those individuals that have higher incomes and can actually pay for some of the services, that releases the burden on those who cannot pay for these services. And we just put that in place. We don't know how that's going to work out. Hopefully it will. But I think overall, continuing to invest in those community-based services and coming up with a mechanism, which we don't have currently, on how can Medicaid come into play there. And that will alleviate some of the burdensome costs that are associated with institutional care. And as I mentioned earlier, here in Rochester, there was a program that was put together about 3 years ago through Lifespan, which is our organization that contracts with the Office of Aging here in Monroe County and many of the counties surrounding us. They created a mechanism to communicate with the healthcare industry, where they had case managers that would walk people through services that would authorize them to, have people at home, get the home care that they needed, get the other social services that they needed, even legal counseling stuff that they might need through elder law programs, and all of that. And it was all through sharing. They also included, in Assemblymember McDonald yesterday when we were preparing, you mentioned the importance of having funding providers. As part of this conversation. They were part of the conversation. So that's those kind of collaborative, creative approaches that help us serve, because it's just not the direct home services that will allow people to stay at home and age with quality of living. It's a whole bunch of other services that they need. And if you can combine those things, then you can reduce the number of emergency department appearances. You can reduce the number of long-term rehabilitation care, and you can at least delay and sometimes prevent them ever going into a nursing home.
And I'm going to jump in with one more question. We've just got a couple of minutes left. Another question from the audience. Private insurance solutions and the public option are worlds apart and often at odds. New York State partnership merged the two ideas and created an exceptional public-private solution, but policies have become priced out of the market. Is there any innovation to the partnership concept on the horizon?
I'll take a stab at that for a second. I think that's an area we really now, more than ever before, I have to go back and revisit. To build off of Harry's comments earlier, a lot of this boils down to is making sure that everyone's rowing in the right direction. The Medicaid redesign, which we've been working through the last several years, really brought a lot of players together to provide services and got providers to talk to each other that normally never talk to each other. We need to go back and reevaluate not only the mechanisms on how we arrive at premiums for long-term care insurance, but also how we can incentivize the carriers that are out there to come back and look at it. Most of them left New York State. That's the challenge, and the cost just got to be atrocious in many aspects. I field many complaints about the high cost of it. So we need to bring the private sector back in this area, but once again, with proper controls as well. This is always the challenge, is that government, we want government to do everything. And unfortunately, we can't always do everything, but what government can do is decide where we're going to be financially in supporting and how we're going to set the margins of how everyone's going to engage. But the other thing we need to do that sometimes we fall short on is we need to also make sure that we monitor and take action.
Well, I
Let me
remember
give a different perspective.
years ago, the beginning of the discussion about the partnership plan. And there was great hope that there was going to be a mix that was going to be an important part of the solution. Obviously, that has turned out not to be the case. But the idea that has been out there for some time with us is the compact for long-term care. And that discussion was started by some of the best and the brightest minds that we have in this area, right here in New York, which is something that continues, I think, to be a model to be followed, not just here in New York, but across the country, as we have this national discussion, which is now more urgent than ever. And so some of the elements of a partnership plan, some of the elements of a compact for long-term care. What's been disappointing to me at any level that I've had the privilege of serving in is that when you create these advisory boards, all too often, it's the wrong people, the wrong professionals that are on these advisory boards. And we know, those of us that serve the elderly and those that serve them, some of the true heroes of our community are some of the best and brightest with some of the greatest ideas that are on this call right now and in our state. And so going forward, rather than have a government top-down solution, certainly I think it's time that we have the best and the brightest that have some of these great ideas on how to best mix government solutions along with marketplace solutions and what us as private individuals and the role that we need to play, whether that's in the compact for long-term care or some other solution need to play. And so, the best solutions, I always say, come from knocking on doors in my community. This is our community, and the best solutions and developing the right kind of mix over and above just the increased government spending going forward is going to be the way for us to move ahead.
Steve, I hear the audience here just saying yes, 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 but you got to let us in the door too. And how do we get in the door? And that's not always easy. Senator May, I know you've been wanting to get in the conversation. I'm going to give you last word.
Oh, thanks. So I'm going to turn it in 180 degrees and say, I think one of the things that we're seeing out of the pandemic is the need for universal health care. And the New York Health Act, it was, I think, a really good thing that long-term care has now been included in that. I haven't had a chance to look at how the financing of that works, and I need to drill down in that. But I do think when we're seeing tens of millions of people put out of work and losing their health care at the same time, people are starting to understand that we can't necessarily go on with the system we have. And so I think we're going to be looking at a radical change in how we fund healthcare and deliver healthcare. So that's my last word. Let me say one other thing, which is just in light of the news that's breaking today about unrest around the country, that one thing that we're seeing about nursing homes is that the racial divide in terms of outcomes in the pandemic is carrying over into nursing homes as well. Even very highly rated nursing homes, we're seeing that people of color are dying at higher rates. And when we have hearings, we have to really ask about that. And when there's oversight, we have to, and even, issues of liability, we have to be asking the question, why is this happening? How can we make sure that everyone is treated equally and and everyone's outcomes are as good as possible. So that's something that I want to be paying a lot of attention to moving forward.
Thank you, Senator. And just as we start to wrap up, I've got a question that came in from a consumer, an activist consumer who I know, and the tag to it is consumers can only pay minimum wage. Many consumers can only pay minimum wage. How do they compete with the unemployment check? So I'm going to leave that for you to contemplate, chew on, and try to help them out with. Again, I apologize for the gremlins that were in my system this morning. I felt a little bit like if any of you tried to sign on some weeks ago to the big Sondheim show, and we waited an hour for that, but then it was worth it. And goodness, you folks were just so wonderful with the information you shared. Senator May, Assemblyman Bronson, Assemblyman McDonald, and Assemblyman Steve Stern. Thank you so very much. And I'm going to turn this back over to our host now. Thank you, and be well, everybody.
Thank you.
Yeah.
Are you ready?
I'm ready. Here we are. Well, thank you to each of our legislators and to Benita for a very interesting, scintillating hour. These are issues that are going to be with us for the next 30 to 40 years. The population swell, the demographics are just going to be putting us in a position where we're going to be talking about this year over year. And hopefully through conversations like this, where we have willing legislators coming to the table and sharing their ideas with us, we can keep this dialogue going and bring some of those innovations to the table. I have to change next slide, please.